It's tea time with Dr. Tiv and Darina. And boy, do we have the tea for you. So we're talking about air polishing, aren't we, Darina?
Yeah.
And we've had some air polishing and we're talking about our journey, but we really want to talk about the PTB machine from Woodpecker because that's the one that we've had a year's worth of experience with now.
Yeah.
And I don't want to spoil it, but Shakara, we like it. But talk to me about our air polishing journey. Because I kind of surprised you with an air polishing machine, didn't I?
You sure did. Like, I was just using traditional, methods of hand scaling and using EMS. I've used Cavitrons. I'm like, why would I change after all these years? So it actually took me a lot of convincing.
It did. In fact, the only way I could convince Darina, because I'm a dentist, Darina's an oral health therapist, the only way I could convince was actually to get a machine in. And it kind of happened by accident. But the reason I wanted it is I didn't like EMS, the ultrasonic cleaning myself. And the reason for that was it was quite painful and really, really uncomfortable. And the noise used to drive me insane. And my teeth were kind of sensitive. So I was like, look, I want to have something so I can get regular hygiene visits often and not have to be cringing about it. And I thought if that was the way I felt, that's probably the way my patients felt as well. So we just happened to get an air polishing machine, not this one, but another one. And Darina got it. And what was your first experience?
Yeah, so many things. But the first thing that really stands out is just the patient experience. It just doesn't compare to traditional methods. Once people experience it, they just go, oh my gosh, I never want to have the other traditional way ever again. And people all of a sudden started talking about it. Like, people in the community would be recommending it. So I'd have people call up and be like, my friend just came in and she had a great experience. I want to have that too. So I feel like we definitely got more patients simply by having this machine and how much less sensitive and more pleasant it was for them.
Yeah. But it does come with a cost because there's extra materials now. You need to get the powder. And the first machine we had used to clog and break down all the time, which we'll get to soon. But there's additional cost because with traditional ultrasonic, it's just a tip which you replace, I don't know, once every 6, 12, 18, 24 months. So it's really economical. But this, how often are we buying bottles of powder?
Yeah, this is true. Like, you do go through the powder quite quickly. I feel like, this is my workhorse, right? So I'm using the air polishing system for every patient every day.
Yeah.
And sometimes I see up to 18 patients in a day. So, I'm going through the powder pretty fast. I feel like I probably change. They come in different sizes, but the little bottle, I probably go through that in a couple of weeks.
Yeah, wow.
Sometimes, yeah.
That's not too bad.
Yeah.
I guess as a business owner, I had to figure out, do we increase the price? Do we keep and absorb it? What do we want? So we start off by just absorbing the costs because we're like, we want to trial out this machine and see if it actually takes. I'm thinking maybe we give the patients the option that if they want traditional, just ultrasonic, it's a traditional price. But if they want the air polishing, then we're going to add a surcharge to it. But I'm not sure yet. But there is some additional costs involved that I guess our audience should be aware of. Now, we had problems with the original machine. We won't name its name here, but what happened?
Everything under the sun happened. I feel like I had the most stressful years of my career with some of the other brands out there. There was just constant clogging.
Yes.
We had to purge the machine ourselves with the other machine.
When you're talking about purging machines, you had to actually get a physical syringe, put it into hand pieces and pump it full of air and water or something.
Air and water. And even with doing all that, they would still clog all the time, and there was nothing you could do once it did.
And for a business owner, when they clogged, these were $1,500 hand pieces. And once they clogged, there's no way to repair them or fix them yourselves. And when you sent them to be fixed, the person was like, I can't even fix them. So they were gone. And we were losing a handpiece a week or a fortnight. It was a lot.
Yeah, I remember this 1 week where I feel like in 1 week we had about 5 hand pieces clog up.
Yeah.
And I was the most stressed I've ever been. And also just in the situation of you're trying to use this on a patient and the machine is just breaking down, it doesn't get more stressful than that,
No. Because then you have patients waiting for you as well. And from a business point of view, it's costing you money as well. We had to get to a point where we banned everyone else from using it. Because a company that's at that point was they kept blaming us for everything that happened. They were like, no, you need to purge it 5 times, not 3 times. And we need to get this compressed can to like dry it up. And then we're like, no, your autoclave is the wrong setting. And it was made of plastic. And so it would start cracking after like a few hundred cycles. And then they were like, no, well, that's the way it's supposed to be. It's a disposable handpiece. And we're like, we just didn't get it. So we banned everyone from using it.
Yeah.
And I think for a 6-month period, only you used it to figure out what was going on.
Yeah, because we had to like remove all the other possible factors and just bring it down to just one clinician doing exactly the same thing, you know. And at one point, I think they even blamed the weather. I think they told us they were clogging up because of humidity. Yeah. And we're in Victoria. Like, if that's happening in Victoria, what's happening in Queensland?
That's right. So we were frustrated by it. So when we met Air Polishing Australia at the ADX, and Liam was like, look, I'm telling you, the woodpecker is much more robust.
Yeah.
It's like you can actually take it apart and you can like open it up and clean the insides, and it's got a self-purging mechanism, so the machine does it for you. I was like, this could be the machine for us. So what did you find when we switched to the PTB?
Oh, incredible. I mean, sure, a clogging will happen, but almost none at all. Like in the last year I've been using it, and I use it every day. I think it clogged maybe 3 times. Yeah. And when it did, I had the reassurance of knowing all I have to do. I mean, I can show you.
Yeah, sure.
Like literally, it's so simple.
It's metal hand pieces too.
The metal is incredible, because another thing that a lot of people complain about with other brands is how much these crack.
Yeah.
Because other brands make them out of plastic, so you get all these cracks through it. This is metal, so incredible, technology.
Yeah.
But yeah, if it clogs up, you literally unscrew the tip. This is all you do. You unscrew it, which you can't do with any other brand that I've seen.
And they give you a cleaning kit as well, I believe.
So you've got like the tip and the handle separate.
And what do you do?
And then with the cleaning kit, you literally just stick the little needle into it and you just move it around a couple of times. And you actually see the powder like come out on the other side, like so simple.
And then it's done.
Yeah, and then you put it back on, test it, and it's usually fine after that. Like absolutely incredible. Just even the peace of mind of knowing that you can do that just takes the stress away.
Yeah. So it was like the company, rather than trying to take advantage of dentists by saying like it's disposable, made of plastic, you need to throw it away, they were like, you have the right to repair it yourself.
Yeah.
You can repair it. It's not going to cost you anything. Oh, and you know the other thing that really frustrated me about the other brand was they had microchips in their machine that if you didn't get it serviced yearly by their people, it would shut itself off.
No.
Yeah. And so I was like, that's just like, you know what it's like? It's like when they bring printers, and if you don't use their ink cartridge, they're like, no, you can't print at all.
Yeah.
And so they were doing the same kind of controlled environment, where with this one, Liam was like, no, you don't even have to service it. Like when things wear out, we'll send you the parts and you just do it yourself. And we had to do it. And I was a bit nervous about it, but it was so simple to change a bit of tubing and there was no issues. So for me as a business owner, the ability for me to choose who was going to repair it, whether it's me or somebody else, gives me great peace of mind. Because I know that I'm not going to be beholden by a certain company. And if that company goes bust, it's not like I don't know what else to do. I can actually go to somebody else and just source the parts myself and fix it, which is fantastic.
Well, I remember when we had the previous model, a different brand, and we had to get it serviced. I had to take apart the whole thing, package it up, send it off, and I was without a unit for like weeks.
Yeah. And they were just like, that's just what happens.
Yeah.
Yeah.
And of course, my patients would rock up to their appointment expecting to have the same experience, but they didn't have that. And so I felt like I was letting my patients down.
Yeah. Any downsides to the PTB? We talked about downsides to the other brands, but they've seemed to solve all of it. Is there anything that you were like, I wish they'd changed something?
I mean, overall, I'm pretty happy with it. Like, it is easy to use. I haven't really noticed a difference with the patient experience with other brands. I think some people mentioned, that they'd like the powder canister to like light up or show that the powder is actually mixing. I guess some of the other brands do that.
Right.
But to be honest, it's never affected me. It's just something I've heard other people say, but I don't think it bothers me at all. In fact, I really like the canister. I think it clogs a lot less compared to the other types.
Yeah.
Yeah.
Okay. I think for me, it would have been nice for us to tell the machine how long we want it to purge itself for. because we feel like we want to, because we had bad experience with the previous brand, we want to purge it more times. So we purge it twice or 3 times. I wish we just purge it once and it just does it for longer. So I think that would be quite good as well. Apart from that, I can't really see any issues. It's robust. We have associate dentists use this, and if your owners out there, sometimes they can not really handle equipment with care, and this thing's been a tank. Like, it's just kept on going, no issues at all. The one thing that you need to be careful of is, this happened to the other machine, and that was a real nightmare, was one of our DAs plugged water into the airline and basically flooded the machine and kind of killed it on day 2. So that was horrible. The way we got around it is we got rid of all our water quick connects into a different connect type. So there's no way they can possibly do that ever again.
Yeah,
we had it labeled and everything, didn't we?
We had it labeled, but still people find a way. So I guess you have to think about human error when it comes to business management, because people will find ways to destroy something. And I guess in this situation, you've got the dangerous mix of, you've got powder and water. And so, if you accidentally mix that up in the canister and through the cords, you're left with clay and concrete within it. So you are screwed pretty much after that.
Yeah, sure. So be wary of that. I don't know, anything else you want to say about the machine? Like, we've got 4 of them now. So we kept buying more and more because I was like, this is fantastic.
I guess what I love about it is it's easy to use, and less strain on the clinician. I find I'm really enjoying moving away from just simple bacteria removal to actually thinking about disclosing the bacteria and thinking about biofilm in a different way. I mean, it gives an opportunity to educate patients, and them seeing that purple gel, it really motivates them and builds value of, why are they here? Why do they come, to have their teeth done at the dentist versus just brushing at home? Yeah. So I think that adds a lot of value. I also love that no matter who's using it, you're going to get pretty much the same effect.
So it standardizes the clinic.
Yeah,
clinicians.
Because as we know, like, not all dentists and oral health therapists and hygienists are gentle. You'll have some that are really gentle naturally, and some who are a bit more heavy-handed. But this takes away that, because no matter who's using it, it's going to be gentle.
Yeah.
I guess the only thing you have to control is just your water. Make sure that you're suctioning all the water out, but that's about it. Like, it's going to be gentle, I think, no matter who's using it.
Okay, nice. For those of you that don't know how the air polishing works, because you might be like, what does it do? From my understanding, you sit the patient down, you disclose their plaque, and then you use this to basically remove the plaque and calculus off their teeth. And then it kind of gamifies it for the patients, which I think is fantastic. Because the patients come in, I've seen them, they come in and like, am I doing better this time than last time? Because you can bring up the photos and kind of compare them and be like, yeah, like, you're not missing this spot anymore, but work more on this side. So you become their dentist or their oral health therapist, because they don't want to see anyone else, because they don't have the background knowledge that you have of their particular mouth and how they're improving with time.
It's almost like we're a coach or a personal trainer about their mouth. They're excited to come back, see the results, see what's improved. Sometimes they'll change their toothbrush or something like that, and they'll be like, oh, is it any better? I will usually let them look themselves, because, that's so powerful if they see it themselves rather than me just telling them about it.
Nice.
Yeah.
Perfect. So in summary, from the owner's perspective, if you ask me what do I think of the Woodpecker PTB air polishing machine, I'm going to give it 2 Dr. Tiv thumbs up, because for me, it's cheaper than other brands, it's more reliable, more robust, maintenance is low, we can fix it ourselves, and if it clogs up, there's a high chance that we're going to be able to unclog it, and it just doesn't clog as much as the other ones do. It standardizes our clinicians so that our patients get the same experience, and if something goes wrong, it's actually really cheap to fix, which for me as a clinician and as a dentist and as an owner, I want to have as least problems as possible. So for me, 2 thumbs up. What about you, Darina?
I think the big one for me, like everything you said, but also just touching on the point that by using this equipment, I was able to reduce my time that I was spending on appointments. I actually pretty much halved my appointment times. They used to be 60 minutes and it turned into 30. That's incredible. So even though we're not charging more for using this machine at our clinic, the fact that I'm able to see double the number of patients, I mean, no brainer.
So it pays itself off pretty quickly.
Paid it off. I reckon it paid it off within a few months.
Yeah, wow. Excellent. All right, well, this is Dr. Tiv.
And Darina.
I hope you enjoy our little tea with Dr. Tiv and Darina. All right, see you guys.